Good day everyone. So today we are going to discuss about the different types of bone fracture. Here's are your teachers for today's discussion. Miss Elaine Pasion, Miss Hyacinth Pen, Miss Caris Rabina, and Miss Angel Rodero. Miss Eliza Sagban and Miss Mary Grace Salvador. Miss Hais Alegrizan Samoy, Miss Macy Sarmiento, and Miss Kyla Jane Serrano.
Good day everyone, I am Elaine Pasion and I am going to present to you the comminuted fracture. Comminuted fracture are a type of a bone that is broken in at least two places. Comminuted fractures are caused by severe traumas like car accidents. You will need surgery to repair your bone and recovery can take a year or longer. These fractures can affect any large or long bone in your body. Some of the most common include your femur or thigh, tibia or shin, fibula or calf, humerus or upper arm, medius or ulna or your forearm, clavicle or collarbone, and skull. So, who gets comminuted fractures? Comminuted fractures, like all bone fractures, can affect anyone. This is especially true because they're caused by serious traumas. There is no way to predict when or how someone will be in an accident, so everyone could experience a comminuted fracture. Comminuted fractures are rare. This because they are caused by severe traumas that most people fortunately never experience. Symptoms and causes of comminuted fractures. If you have a fracture, you'll also experience serious symptoms of the trauma that caused it. Your symptoms will depend on the other injuries you have, but in general, the symptoms of comminuted fractures can include intense pain, not being able to move a part of your body you normally can, a part of your body noticeably different looking or out of its usual place, seeing your bone through your skin, swelling, or bruising. So what causes comminuted fractures? Comminuted fractures are caused by trauma. Some of the most common causes are car accidents and falls from a great height like off a ladder or roof. So what tests are done to diagnose a comminuted fracture? You'll need at least one of a few imaging tests to take pictures of your fractures. Some are X-rays. An X-ray will confirm any comminuted or other fractures and show how damaged your bones are. Next is magnetic resonance imaging or MRI. Your provider might use an MRI to get a complete picture of the damage to your bones and the area around them. This will show them the tissue around your bones too. This is especially important to determine how your muscles, connective tissues, and organs were affected. This is especially important to determine how your muscles, connective tissue, and organs were affected by the trauma. Another one is CT scan. It will give your provider or surgeon a more detailed picture of your bones and the surrounding tissue than an X-ray. So, how are comminuted fractures are treated? You'll need surgery to repair a comminuted fracture if one of your long or large bones is broken. There are few techniques used to repair comminuted fractures. One is the internal fixation, which means your surgeons insert of metal into your bone to hold it in place while it heals. Internal fixation techniques includes a rod inserted through the center of your bone that turns from top to bottom. Next one is plates and screws. Metal plates screwed into your bone to help them in place. Next is pins and wires. Pins and wires hold pieces of bones in place that are too small for other fasteners. They'll typically be used at the same time as either rods or plates. You'll probably need pins and wires to hold the pieces of your bone together after comminuted fracture. Some people live with these pieces inserted in them forever. You might need follow-up surgeons to remove them. Next one is the external fixation. This is often a temporary solution that stabilizes your fracture while your other injuries heal. Your surgeon will put screws on either side of the fracture inside your body, then connect them to brace or bracket around the bone outside your body. The next one is bone grafting. You might need bone grafting if your comminuted fracture is severely displaced or if your bone isn't healing back together as well as it should. Your surgeon will insert additional bone tissue to join your fractured bone. After that, they'll usually perform an internal fixation to hold the pieces together while your bone regrows. Bone grafts can come from a few sources. Internally from somewhere else in your body, usually the top of your hip bone, an external donor, an artificial replacement piece, and etc. On their own comminuted fracture, surgeries are outpatient procedures, which means you might be able to go home the same day. However, it's likely the trauma that led your comminuted fracture cause other injuries that will require you to stay in the hospital to recover. So, how long does comminuted fractures takes time to heal? Comminuted fractures take longer to heal than other kinds of broken bones. They are also much more likely to involve complications. Most comminuted fractures take around a year or longer to heal. The exact time it takes your bones to heal will depend on the severity of your fracture and if you develop any complications. Green stick fractures. These are type of a broken bone that happen when a fall or other accident bends a bone so much that it cracks along one side without breaking into multiple pieces. Almost all green stick fractures affect children younger than 10 because they have softer and more pliable bones than adults do. The types of green stick fractures. Green stick fractures usually affect longer bones including your humerus, radius and ulna, phalanges, femur, fibula, and how common are they? Green stick fractures are extremely common injuries, especially for children. What are green stick fracture symptoms? The most common green stick fracture symptoms include pain, bruising or discoloration, tenderness, swelling, and part of your child's body looking more bent or twisted than usual. What causes green stick fractures? Anything that puts a lot of force on one of your child's long bones can cause a green stick fracture. The most common causes include falls, especially catching themselves from a fall with outstretched hands, sport injuries, or car accidents. What tests do providers use to diagnose fractures? Your provider will use X-rays to take pictures of your child's bones to confirm a green stick fracture. They may also use magnetic resonance imaging or MRI or computed tomography CT scan to take three-dimensional pictures of your child's bones and the surrounding tissue, especially if they need surgery. Green stick fracture surgery. Your child might need surgery to repair their bone, especially if the green stick fracture has a severe angle bend. Your surgeon will realign your child's bone to its correct position and secure it in place so it can heal and grow back together. They usually perform what's called an internal fixation, which means your surgeon inserts metal pins into your child's bone to hold it in place. They might need follow-up procedures to remove the pins after their bone has healed. The healing time. Most green stick fractures take around 6 weeks to heal. How long it will take depends on which of your child's bone is broken, the fracture severity, and if they are experiencing any other injuries. Your provider will tell you what to expect and when they can resume physical activities.
Good day everyone, my name is Hyacinth Pen and I'm gonna report about transverse fracture. Transverse fractures are a type of broken bone. Transverse fracture run horizontally perpendicular to your bone, opposite the direction of your bone. You might see them referred to as complete fractures. This means the line of the break goes all the way through your bone. Transverse fractures are almost always caused by traumas like falls or car accidents. You might need surgery to repair your bone. Some people only need a splint or cast for the bone to heal. How long it takes to recover fully depends on which of your bones are fractured and what caused the breaks. Most people need a few months to recover from a transverse fracture. Transverse fractures versus transverse process fracture. Transverse fractures and transverse process fracture are different types of bone fractures. Even though they have similar names, but they are very different injuries. A transverse fracture occurs when your bone is broken perpendicular to its length. The fracture pattern is a straight line that runs in the opposite direction of your bone. They can happen to any bone in your body, but usually affect longer bones after a trauma like a fall or accident. A transverse process fracture are a type of a spinal fracture. The transverse process is the bony projection on either side of your vertebrae, the bones that make up your spinal column. They usually caused by traumas like any other type of a broken bone. Some transverse process fractures are caused by osteoporosis, weakening your bones without you knowing. Transverse process fractures can happen along any part of your spine, but they're most common in your lower back, your lumbar spine. A transverse fractures versus a oblique fractures. A transverse fractures and oblique fractures are both types of fractures that create a straight break across your bones with. Transverse fracture run horizontally perpendicular to your bone, opposite the direction of your bone. Oblique fractures are angle across your bone. No matter which names and terms end up applied to your fracture, the most important first step is getting your injury examined by a provider as soon as possible. How common are transverse fractures? Transverse fractures are one of the most common kinds of broken bones, especially within long bones. Who gets transverse fracture? Transverse fracture can affect anyone. This is especially true because they're caused by accidents and traumas. If you're at risk for falls, you might be more likely to experience a transverse fracture. People with osteoporosis or weakened bones have an increased risk for all of types of broken bones, including transverse fracture. What are the symptoms of transverse fracture? Symptoms of a transverse fracture include pain, swelling, tenderness, inability to move a part of your body like you usually can, discoloration, a deformity or bump that's not usually on your body. Open versus closed fractures. Your healthcare provider will classify your fracture as either open or closed. If you have an open fracture, your bone breaks through your skin. Open fractures usually take longer to heal and have an increased risk for infection and other complications. Closed fractures are still serious, but your bones does not push through your skin. Displaced transverse fractures. Displaced or non-displaced are more words your provider will use to describe your fracture. A displaced fracture means the pieces of your bone move so much that a gap formed around the fracture when your bone broke. Non-displaced fractures are still broken bones, but the pieces were not moved far enough to be out of alignment during the break. Displaced fractures are much more likely to require surgery to repair. What causes transverse fractures? Any impact on your bones can cause a transverse fracture. Some of the most common causes include falls, car accidents, sport injuries. How are transverse fractures diagnosed? Your healthcare provider will diagnose a transverse fracture with a physical exam and imaging tests, including X-ray. An X-ray will confirm any fractures and show how damaged your bones are. Magnetic resonance imaging, or MRI. Your provider might use an MRI to get a complete picture of the damage to your bones and the area around them. This will show them the tissue around your bones too. This is especially important to determine if your muscle, connective tissues, and organs were injured. CT scan. If you need surgery, your provider or surgeon needs to know exactly how damaged your bones are. A CT scan will give them a more detailed picture of your bone and surrounding tissue than an X-ray. You might need a CT scan if your X-ray were inclusive or to help your surgeon plan your surgery. How are transverse fractures treated? How your transverse fracture is treated depends on your severity of the original break. Your broken bones need to heal back together, depending on how damaged they are and what them to break. There are few treatments your provider might use. Immobilization. If your fracture is mild and the bones did not move far out of place, if it's not displaced, you might only need a splint or cast. Splinting usually lasts for 3 to 5 weeks. If you need a cast, it will likely to be for longer, typically 6 to 8 weeks. In both cases, you likely need follow-up X-ray to make sure your bones are healing correctly. Close reduction. More severe breaks require a close reduction to set or realign your bones. During this non-surgical procedure, your provider will physically push and pull your body on the outside to line up the broken bones inside you. To prevent you from feeling pain during the procedure, you receive one of the following: local anesthetic to numb the area around your fracture, sedatives to relax your full body, general anesthesia to make you sleep through the procedure. After the close reduction, your provider will put you in a splint or cast.
Good day, everyone. My name is Caris Lial Pirabina. I would like to discuss oblique fractures. Oblique fractures are a type of broken bone. They happen when one of your bone is broken at an angle, depending on which of your bones is broken. What is oblique fractures? Oblique breaks occurs at the angle across the bone. Usually, one fragment is slipped by the other. I will explain what is oblique fractures. Oblique fractures occur when your bone is broken at an angle. The fractures is a straight line that's angled across the width of your bone. They usually goes by landing on your bone at an angle after a fall. Example of oblique fracture, like a car accident. As you can see in the picture, we have two types of oblique fractures. First, displaced fractures and non-displaced fracture. Displaced fractures means the pieces of your bone move so much that a gap forms around the fracture. Non-displaced fractures are still broken bones, but the pieces weren't moved far enough to be out of alignment during the break. Displaced fractures are much more likely to require surgery to repair. What causes oblique fractures? Any impact to your bones can cause oblique fractures. They're usually caused by something hitting your body at an angle. Some of the most common causes are falls, car accidents, and sports injuries. Symptoms and causes. What are the symptoms of an oblique fracture? Symptoms of an oblique fracture include pain, swelling, tenderness, inability to move a part of your body that you usually can, bruising or discoloration, the deformity or bump that's not usually on your body.
Hello everyone, my name is Angel Caclay Rodero and my topic is compression fracture. What exactly is compression fracture? Compression fracture is a fracture that caused by force from both ends, commonly seen in vertebrae. A compression fracture is a type of fracture that occurs in the bones, particularly in the spine. It happens when there is a collapse or compression of the vertebrae, which are the small bones that make up the spinal column. This can result in the loss of height in the affected vertebrae and can cause pain, limited mobility, and other symptoms. A common situation where a compression fracture may occur is in individuals with osteoporosis, a condition characterized by weakened bones. Osteoporosis can make the bones more prone to fractures, and the spine is a commonly affected area. A sudden, forceful impact, such as a fall or trauma, can also cause a compression fracture in individuals with healthy bones. For example, imagine a 60 years old woman with osteoporosis who accidentally slips on a wet floor and falls backward onto her back. The impact causes excessive pressure on her spine, resulting in a compression fracture in one of her vertebrae. As a result, she experiences severe back pain, limited mobility, and a decrease in height. So, it's important to note that compression fractures can vary in severity from mild compression to more significant collapse of the vertebrae. The treatment for compression fractures often involves pain management, rest, bracing, and physical therapy to help relieve pain, improve mobility, and promote healing. In severe cases, surgery may be necessary to stabilize the spine and restore vertebral height. And that's the topic all about. Thank you.
Good day, everyone. Today, I'm going to discuss to you the closed fracture, or also known as a simple fracture. Closed fracture is a fracture that does not communicate with the external environment, that overlying skin and soft tissues are intact. As we can see in the picture, the bone is broken, but the skin is intact. This fracture occurs usually when excess force is put on the bone. For example, is twisting, falling, trauma, jarring or bending, a direct blow or kick to the body, and diseases that weakens the bone. Some symptoms of closed fracture may include sudden pain, swelling, skin redness in the injured area, warmth, difficulty using or moving the injured area or nearby joints, numbness, weakness, and bladder or bowel problems. So, closed fracture can be treated by putting back in place or keeping it from moving. Pain management, time for the bone to heal, preventing complications, restoring normal function, splint or cast, pain medication, traction, and it may also require surgery for proper treatment. But for most often, this surgery is not as urgent and can be performed in days or weeks following the injury.
Good day everyone, I'm Mary Grace Salvador and I'm here to discuss about the type of fracture which is spot fracture. What is spot fracture? Spot fracture is a fracture at the distal end of the fibula with injury to the tibial joint often involving the ankle. Spot fracture are often experienced by volleyball player, basketball player, soccer player, sepak takraw player, and many more. So example is when a volleyball player is spiked and she landed on the floor with the wrong position of her feet and she may experience spot fracture where her fibula and tibial joint is injured or fractured. So spot fracture has three classification: the unimalleolar fracture, the bimalleolar fracture, and trimalleolar fracture. Unimalleolar fracture involves either the distal fibula or the tibial. In unimalleolar fracture, it is only happened in one joint or either the distal tibia or the distal fibula. Next is bimalleolar fracture. Bimalleolar fracture is an ankle fracture that involves both the tibia and fibula. So in unimalleolar fracture, it's either on fibula or in the tibia. And here in the bimalleolar fracture, it's in both tibia and fibula, as you can see in this picture. So next is the trimalleolar fracture. In a trimalleolar ankle fracture, your ankle joint is broken in three places, which is the lateral malleolus, medial malleolus, and posterior malleolus. Lateral malleolus is the lower part of the fibula near the ankle joint, and medial malleolus is the inner part of the lower tibia near the ankle joint. Posterior malleolus is in the back part of the tibia right at the level of the ankle joint. So here's are the treatment of Pott's fracture. It's either immobilization, surgery, and rehabilitation. So it also includes wearing a cast, brace, or walking boot to stabilize the ankle and allow it to heal. So, healing time. The recovery time for a Pott's fracture varies depending on several factors, including the severity of the fracture, the chosen treatment approach, and individual healing factors. In general, it can take several weeks to a few months for the fracture to heal. It may take 7 to 12 weeks for the fracture to heal. So that is about Pott's fracture and thank you.
So now we are going to tackle about the types of fracture which is spiral fracture. Spiral fractures is a distinctive type of bone fracture characterized by a twisting or spiraling pattern along the length of the bone. It is typically occurs as a result of torsional or rotational forces applied to the bone, leading to a unique fracture pattern. This report provides an overview of spiral fractures, including their causes, common locations, diagnosis, treatments, and potential complications. So these are the causes of spiral fractures. Sport injuries, motor vehicles accidents, and falls. Sport injuries is activities such as skiing, football, and basketball. It is often involved quick changes in direction or sudden twisting motions, which can result in spiral fractures. Motor vehicles accidents. In car accidents, especially those involving rollovers, the seatbelts or airbag mechanism can exert twisting forces on the long bones, leading to the spiral fractures. The last one is falls. Falling from a height or stumbling and twisting the line upon impact can cause spiral fracture, particularly in the lower extremities. The spiral fractures can occur in a various bones, but some locations are commonly affected, including the tibia, femur, and humerus. Tibia or shin bone is a spiral fractures in the tibia are frequent, especially among the athletes and individuals involved in a high sports. Femur or thigh bone. Spiral fractures of the femur are often associated with several traumas such as car accidents, and the humerus or upper arm falls on an outstretched hand leading to twisting motions can result in a spiral fractures of the humerus. Spiral fractures, this is the mechanisms of injury. Twisting or torsional force on a bone causing a spiral or helical fracture pattern. Anatomy involved any long bone in the body, commonly the femur or tibia. Clinical presentation: pain, swelling, visible deformity, and limited movement. Diagnostic techniques: X-ray, CT scan for accurate assessment. Treatment approach: realignment and stabilization through casting or surgery. Recovery and prognosis depends on the bone involved and the severity. Rehabilitation is crucial. Preventive measures: strengthening exercises, proper warm up, and safety measures during physical activities. Healing time: 6 to 10 weeks considering bone stability and bone alignment.
Good day everyone, I am Missy Sarmiento and I'll be presenting one of the types of fractures, the impacted fractures. Understanding impacted fractures, causes, types, and treatment, introduction to the topic and its significance in orthopedic medicine. What is an impacted fracture? An impacted fracture occurs when a bone is fractured and driven into another bone, causing compression. Also called a buckle fracture is a break. This is often seen within the children's arms fracture. Causes of impacted fractures are the high energy trauma, for example, the falls and the car accidents, direct impact to a bone, sports injuries, pathological conditions weakening the bone. Types of impacted fractures are the compression fractures. Bones are crushed, causing them to shorten. Vertical compression fractures. Bones are compressed along their length. Horizontal impaction fractures. Bones are composed at the right angle to their length. Symptoms and clinical presentation. Under these are the pain at the site of the fracture, swelling and tenderness, limited range of motion, and deformity or angulation in severe cases. Diagnostic approaches: physical examination, X-rays, CT scans, or MRI for detailed imaging. Bone density tests for assessing underlying conditions. Treatment options. Under the treatment options, we have the non-surgical. And under the non-surgical, we have the immobilization with cast or splints, pain management and physical therapy. And now we have the surgical treatment options. Under the surgical treatment options, we have the open reduction and internal fixation or the ORIF, and the external fixation or for severe cases. Complications and considerations. Potential risks associated with surgery, postoperative care and rehabilitation, long-term implications for the affected limb. Rehabilitation and recovery. Importance of physical therapy in restoring mobility and strength, gradual return to regular activities and medical guidance. Prevention and risk reduction. Under this, we have the lifestyle modifications. An example of lifestyle modifications are the diets and the exercise. It is to promote a healthy bone. Safety measures to minimize the risk of traumatic injuries. And that is all for the impacted fractures. Thank you for listening. Now I will be discussing the Coles fracture. Here is the definition of the Coles fracture. Coles fracture is a specific type of wrist fracture involving the distal radius bone. It is named after Abraham Coles, who described it in the early 19th century. It is commonly occurs due to a fall on an unstretched hand. The Coles fractures, the most common fracture of the wrist, was first described by Abraham Coles in 1814. In this injury, there is a complete fracture of the distal radius, typically the last 2 centimeters, usually accompanied by damage to the ulnar collateral ligament or the ulnar styloid process. Middle-aged women and elderly are more commonly reported with this type of fracture. Here is the anatomy of the Coles fracture. Clinical presentation and assessment. The clinical presentation of Coles fracture is frequently described as a dinner fork deformity. Distal fracture of the radius causes posterior displacement of the distal fragment, causing the forearm to angle posteriorly just proximal to the wrist, with the hand displaying its smaller forward arc. The patient's forearm and hand resemble the curvature of a dinner fork. And here is the visual presentation of the dinner fork deformity. Causes of Coles fracture. Falls into an unstretched hand, sports injuries, motor vehicle accidents, and osteoporosis. Coles fracture typically occurs when a person falls and uses a pronated hand and unstretched arm to try to break the fall. In this position, the wrist is usually at a 40 to 90 degree in the wrist flexion. The pressure from the fall overextends the hand and breaks the radius just above the wrist. When this occurs, the distal part of the bone tends to become dorsally displaced. It is also frequently comminuted, meaning it is broken into multiple pieces. Here are some symptoms of Coles fracture: pain and swelling, deformity of the wrist, limited range of motion, bruising or discoloration. Patients with a Coles fracture may experience these common symptoms, which should be prompt immediate with medical attention. Diagnosis and imaging. Here are some methods of diagnosis. First is the physical examination. Second is the x-rays. A physical examination along with x-ray is typically used to confirm the presence and severity of a Coles fracture. Treatment options. Under the treatment options, we have the non-surgical treatment. And under the non-surgical treatment, we have the immobilization with the cast, pain management. And now we have the surgical treatment. In surgical treatment, we have the close reduction and internal fixation, or the CRIF, and we have the open and internal fixation, or the ORIF. Depending on the severity of the fracture, both the non-surgical and the surgical options are available for treatment. Now we have the complications of the Coles fracture. We have the malunion, persistent translation of the corpus, shortening of radius, stiffness of the wrist and the forearm, stiffness or reduced mobility, nerve damage, and the compartment syndrome. Patients frequently heal with no complications at all. If redisplacement of the Coles fracture is seen a few weeks after the reduction, it is important to take and check radiograph a week or up to 10 days after the injury. Rehabilitation and recovery. Post-treatment care. Under post-treatment care, we have the physical therapy, exercises to improve range of motion, strengthening exercises, and also we have the expected recovery time frames. Rehabilitation is essential for restoring wrist function and strengthening the injury after the treatment. Here are some tips for preventing Coles fracture. Number 1, fall prevention strategies. Number 2, strengthening exercises. Number 3, osteoporosis management only for individuals at risk. Proactive measures can significantly reduce the risk of experiencing a Coles fracture. Special concerns in children and elderly. Due to the abundant circulation in that region, the fractured part of the radius tends to diffuse well. If this fracture occurs in children, however, fracture line may extend to the distal epiphyseal plate, potentially leading to misalignment of the plate with the radius. If this occurs, growth of the radius may be affected. In some patients above the 50 years of age, osteoporosis screening is recommended for a better outcome. Osteoporosis is one of the biggest risk factors in risk fractures, and patients suffering from osteoporosis tend to have a greater deformity after the Coles fracture. And that is all for my presentation. I hope you learned something. Thank you for listening.
So, good day everyone. Good day, sir. I'm Kyla Jin Serrano and I'm going to present to you the open fracture. An open fracture or compound fracture refers to a broken bone that causes an open wound or break in the skin. This type of traumatic injury requires emergency treatment to set the bone and prevent infection in the wound. Open fracture: a fracture associated with an open wound where the broken bone may protrude through the skin. As you can see here in the figure 1, where is the broken skin, the tibia, and the fibula. And as you can see here in the figure A, this is how it looks like. So let's proceed. Types of open fracture. The type 1 of the open fracture is the low-energy clean wound that is usually less than 1 centimeter length with minimal soft tissue injury and minimal bone comminution. As you can see in the figure, this is how it looks like. Next is the type 2 of the open fracture is low to moderate energy injuries with wounds that are greater than 1 centimeter with moderate soft tissue and the muscle damage. This is how it looks like. Okay. The type 3 of the open fracture is the high velocity injuries have wound greater than centimeter. So this is how it looks like. And The type 3 is divided into three types. So the number one is the type 3A, which is adequate soft tissue coverage of the fracture despite high energy trauma or extensive laceration or skin flaps. As you can see in the figure, this is how it looks like. And the type 3B also is extensive soft tissue loss with periosteal stripping and bone exposure. Observe the difference of the two, and that is how it looks like. And next is the type 3C, any open fracture that is associated with vascular injury that requires repair, plus major arterial injury requiring vessel reconstruction. Next is what causes open fracture? Some cause of open fracture is severe trauma or accidents involving sharp objects, motor vehicle accidents with penetrating injuries. Also, we get a open fracture from falling from a height, motor vehicle accident, and direct blow or these sports. First aid. Number 1. Call emergency service immediately. Next is to cover the wound with a clean cloth to prevent infection. Next is avoid moving the affected limb and keep the injured person still and calm until the medical help arrives. The healing time is prolonged. Healing due to infection rates is typically 3 to 6 months and more. So that's all, and thank you.